We're going to look at standard 2 for a minute now, and that has to do with control. This is also something that's very important to OTs in their workplace, and the research tells us that the amount of control people perceive that they have can greatly influence their engagement and their feelings of exhaustion or being overwhelmed in the workplace. Standard practice should be that employees indicate they are able to have a say about the way they do their work and that systems are in place locally to respond to individual concerns. So again, you're looking for measurable, demonstrable indicators that that standard have been met. Employees have control over their pace of work. Employees are encouraged to use their skills and initiate an initiative. Where possible, employees are encouraged to develop new skills. Employees have a say over when breaks can occur, and employees are consulted over their work patterns. So you're looking, again, measurable, achievable outcomes there. So those are just some examples from the UK that I thought were most relevant to our question about psychological well-being in the occupational therapist workplace. But you can use those tools later on when you're working to look at other people's workplaces as well. So if we did, was going to be an in-classes activity, but I guess we'll just, again, think about it and contemplate deeply what interferes with OT control in the workplace. So we could break this down, right? We've looked at all these other structures now, the one provided by the Guarding Minds at Work and as well as the standards from the UK government. We could talk about OT's factors. What about the OT controls allows them control in the workplace? What about the organizational factors? What about the profession's factors itself? What about the OT profession? And lastly, what kinds of societal and policy factors influence how much control we have at work? So those are all just things to ponder, and hopefully we get a chance to talk about them when we pass in the hallway sometime. Another standard that I wanted to bring to your attention is the one about support. And this includes encouragement, sponsorship, mentorship, those sorts of things that exist in an organization. And the standard says that standard practice should be employees indicate that they receive adequate information and support from their colleagues and superiors, and that the systems are in place to make sure that happens. So what does that look like? The organization actually has policies and procedures about support. And you would be amazed how many organizations don't have that. They don't have a standardized procedure or a policy about mentorship or about orientation even. A lot of people just get thrown into a job and away you go. Anyway, so you can read through this on your own, but again, they need to be measurable, achievable. These are things that your organizational health and safety committee can help you develop for your organization. You bring that to their attention and say, look, we need a larger psychological health program, and here are some tools to help us achieve this, right? Because there's nothing more soul destroying than only receiving regular and constructive feedback, but only during that once a year performance appraisal. And sometimes you wonder, well, just how constructive was that? Nobody wants to wait for a whole year to get any feedback. Anyway, I won't go on about this, but you can see we have the tools, and now it's more getting the network together to do it, because it's not a one-person job and it's not a one-person responsibility. Relationships, it's the same thing. We could talk a lot more about this, about conflict and unacceptable behavior in the workplace. This is one that more and more organizations are actually starting to address, because they're understanding that although we were very concerned about bullying amongst young people, we now need to also recognize that bullying behavior carries over into the workplace as well. So what do you think? There's some important information for us from the different research that's out there. There certainly isn't a lot for occupational therapists, but there are some key articles. The Scanlon one is the most recent one for 2013, and it's mostly, well, it is basically related to mental health OTs in Australia. And they had a very interesting conclusion that I haven't seen in any of the other literature. Excuse me. They concluded that OTs perceived clients and families were unrealistically demanding. And they speculated that that was perhaps because for some clients, the OT was the person they saw the most often. And all of the frustration that they felt about how they were treated by the rest of the healthcare system ended up getting offloaded onto the occupational therapist because they were the friendly ear. But what that meant then was that the therapist was getting constantly bombarded by a lot of negative emotion and content and stressful stories, and it became very difficult for that OT to stay engaged. Just something to think about. It's an interesting article. Another standard, the role, and again, this relates to what occupational therapists were talking about. They felt that their role was not respected and that they weren't actually able to act within their role. They were being asked to do things that really weren't as relevant as what they knew they could be providing. But because people didn't understand the role of occupation and occupational therapists, they were constantly having to justify what they did or feel that they were being sometimes even covertly criticized. Not even, it wasn't even that overt in their face, but people had concerns about that. They raised it in the focus groups that we did for the SAOT project that's related to this. And anyway, I won't go on about it, but role clarity is so important. And again, it's not something that an individual OT can walk into a job and necessarily have the resources or the authority to change on their own. You have to have allies and you have to have evidence behind you to help an organization understand what your role is and how they can best use you. Change, we see a lot about change. It's overwhelming, the amount of change that's going on, and I'm not going to go on about okay, so that's a good place to stop, right? Because I'm sure you're feeling a little bit overwhelmed, and we've talked a lot about the problem and a little bit about the solutions, but that's to come in the presentations that you do. So I'm hoping you're taking note of all these different resources that are available, because we do have a lot. We just have to start moving forward with them now. Have you ever heard of the Red Queen syndrome? Because that's sort of where a lot of people, I think, in the profession are feeling, that they're stuck in Alice in Wonderland and they're Alice running along with the Red Queen. And oh my goodness, here's one more problem we're supposed to fix. So the Red Queen syndrome says, "My dear, here we must run as fast as we can just to stay in place. And if you wish to go anywhere, you must run twice as fast as that." And it's true, right? Some days you just feel like you are treading water. You are running to stay in the place where you are. And the idea of coping with more change is just too overwhelming. So again, psychological safety and reduction of risk are so important. People should never feel like they are alone with this, feeling isolated, and they have to just keep running to tread water and not think about anything. So we can't address this alone. We have occupational health and safety issues. They are not anyone's individual responsibility. And the workplace culture can change. It's not the worker necessarily who has to change. It's a shared responsibility. Employees, and that's an important thing to keep in mind, right? Employers have a legal responsibility to provide a healthy, safe environment. And we have to remember that. This is not some special favor when you want your employer to look after people's psychological safety in the workplace. It's an important thing. Their health and safety encompasses both physical and psychological safety.